How do you know if your patient has an arterial line versus an IV? Here are some ways to differentiate between an arterial line versus an IV because it's very important to know the difference between the two. One is because they have different uses. Arterial lines can be used for continuous blood pressure monitoring. We can draw labs off of them, but we do not commonly administer medications through arterial lines. IVs, on the other hand, are very common for administering fluids and medications. We cannot monitor someone's blood pressure through an IV, and we can sometimes draw labs off of them. First and foremost, arterial lines are commonly placed in only a couple of locations on adult patients. The most common location you'll see is in the radial artery, which is just right kind of above the patient's thumb in their wrist area. You may also see the brachial artery, which is higher up, sometimes the ulnar artery, which is on the other side of the patient's wrist. And then in an emergency, or if you're having trouble getting access for an arterial line, you may see it placed in the femoral artery. Arterial lines also have to be under pressurized tubing. So if you actually pinch and squeeze this arterial line tubing, it's going to be hard. You're not going to be able to compress it like IV tubing. You may also notice some pulsating right here. You may see either the fluid or maybe like there's a little tiny residue of blood in there that would be pulsating with the patient's pulse. You should not see pulsating in an IV. If you do, you probably accidentally placed an arterial line. Arterial lines also have this really kind of complicated setup. You're going to have the tubing that's connected to the arterial line. You're going to have a little transducer, and I'll show a picture of that in a second. And then it's going to be connected to a pressure bag. Here's a closer look at the transducer of an arterial line. You can also see there's not really like a good way to administer medications through an arterial line setup. And this is done intentionally because we don't administer 99.9% of medications through arterial lines. Yes, there are some exceptions in procedural areas like IR and cath lab, but in general, you're not giving your day-to-day bedside medications through an arterial line. They should be done through a venous source. And if you need just one more thing to differentiate between arterial lines and IVs, it's going to be the color of blood that you obtain from each of them. Arterial blood is much more oxygenated, so it is going to be brighter red in color, and venous blood is going to be much darker in general, because yes, there are some patients that are so sick that you draw their arterial blood and it looks like venous blood, but in the average patient, yes, their arterial blood should be much brighter than their venous blood. And those are some easy ways to differentiate between the two lines. And if you are super familiar with them, then you're going to be like, well, duh, yeah, I already know this. But if you're new to ICU, hopefully this is helpful.